we as a country are shifting to greater degree of care at home. It became also clear that the home-based care ecosystem was lacking technology and infrastructure to enable it to operate more efficiently and more seamlessly.
You worked for, with health plans at Oscar, in PE, and operations. What gap did you see that others were missing?
I think that seeing the problem from different vantage points really kind of helped us to understand where the real pain points existed. You ask yourself, why is it that today in 2026, you can push a button on your phone and have literally any product in the world delivered to your doorstep in under 48 hours, but to get patients critical and life-saving equipment and supplies is so challenging.
Where do you see providers struggling the most? Would it be like referrals, reimbursement, staffing, coordination?
Order management and intake remains the kind of biggest overarching pain point. Specifically, next would be fax wrangling, so orders that come through fax and navigating and processing those. All of that flows into to ultimately get paid for the work that suppliers are doing.
All right, we are live on the Claim to Fame podcast, and today we have a very special guest, Vijay Kedar from Tomorrow Health. Welcome to the show today.
Thanks, guys. Great to be here with you.
Yep, welcome. Happy New Year also.
Happy New Year, that's right.
Yeah, new year, new us.
Yep.
That's it.
Usually we start off with kind of a little bit about you. In case, the listeners don't know who you are, tell us a little bit about yourself and your company.
Happy to. Well, bit about me. Originally grew up in Pittsburgh, Pennsylvania, born into a big family of physicians. I often joke that I was pre-med coming out of the womb, but initially started my career investing in healthcare tech and services companies, and then spent a number of years at a company called Oscar Health, a tech-forward health insurance company based here in New York, wearing a couple of different hats as we grew from the first 20 employees to a team of over 2,000. And serving now over 1 million members for health across the country as a public company. And then founded Tomorrow Health a little over 6 years ago, initially inspired by a personal experience managing my mother's home-based care. She was a stage 3 cancer patient, developed a lung disease from her chemo, and spent about 4 months inpatient in the ICU. And coming home from that, just needed a wide range of home-based care. Everything from 14 liters of oxygen, ostomy, wound care supplies, mobility, respiratory equipment, as well as physical and respiratory therapy and support. And we just learned firsthand how challenging that was for so many patients and families to coordinate. Faxing prior authorization forms into the insurance company, coordinating with her panel of physicians, trying to understand the different types of DME equipment that she needed, how to set it up, how to use it, what to do when things would stop working in the middle of the night. And unfortunately, in her case, we had to readmit her back to the hospital twice in that first month. And so it's just really eye-opening as to a lot of the challenges that patients face in making that transition to home. And while at Oscar, I also saw some of the same pain points from the insurance company's vantage point, because I was overseeing our discharges across the country, and we'd very frequently have members that were stuck 2 or 3 extra days in the hospital due to the administrative complexity of getting them the right DME. And so, it opened my eyes that, while we as a country are shifting en masse to greater degree of care at home, and I deeply believe in that shift, the importance of that shift for patients and reducing cost overall, it became also clear that the home-based care ecosystem was lacking technology and infrastructure to enable it to operate more efficiently and more seamlessly. And the deeper we got into it, we saw that, the pain was felt by everybody. It was certainly felt by suppliers that were operating in an increasingly deflationary reimbursement environment with a greater degree of expectations on the service they provided and the processes that they managed. It was challenging for ordering providers that were spending up to 90 minutes to coordinate and manage an order for DME, oftentimes delaying a discharge or missing another patient service opportunity. And then most of all, a lot of that brunt was felt by patients. And so that's what inspired our mission at Tomorrow to restore the home as a patient's primary place of care, and has supported our journey to provide technology to improve and enhance how the DME and home-based care ecosystem operate in America.
Vijay, thanks so much. Super insightful. Like you said, you worked for, with health plans at Oscar, in PE, and operations. What gap did you see that others were missing?
I think that seeing the problem from different vantage points really kind of helped us to understand where the bodies were buried, if you will, where the real pain points existed. Because if you look at it from any one party's vantage point, you just see a different lens on it, right? And you ask yourself, why is it that today in now 2026 you can push a button on your phone and have literally any product in the world delivered to your doorstep in under 48 hours, or have a car show up outside your front door in under a minute? But to get patients critical and life-saving equipment and supplies is so challenging. And ultimately, the conclusion that we came to, that it was really two things. One was the upstream administrative complexity in the payment rules. That unlike other categories where maybe there's a handful of codes that get billed, DME, as you all know, there's 3,500 HCPCS billing codes. There's over 100,000 products and variation in benefit design across thousands of insurers that are constantly changing and being adapted. And that administrative complexity, when it filters down through the system, just causes all these bottlenecks, because an ordering provider doesn't know, the specific documentation that's necessary for this product because of this patient's insurance. A supplier that may be operating their processes manually is running off of tribal knowledge of what this insurer likes to see and how they like to have something coded. And when all of the interaction points between these various stakeholders are analog, it just wastes everybody's time, right? And it causes delays, mismanagement, economic challenges. The first pain point, underlying pain point to us was administrative complexity and reimbursement. And then the second was the wide breadth of analog and manual workflows as opposed to digitized rails. And so, I think seeing it from the different lenses that you mentioned really helped us to identify that, one, we had to digitize those rails, but secondly, we had to build a model that could drive adoption from each of those stakeholders. And that's one of the challenging things about building in healthcare altogether, right? You can never just serve one customer. And that just became clear here, right? It had to be a solution that drove value first and foremost for suppliers that were delivering care, for ordering providers that oftentimes initiate that order, and also for health plans, because health plans have a lot of control and leverage in the ecosystem to determine who's in network, what the payment rules are, how they're going to evaluate the types of products or services that they're going to enable members to receive. And so all of those perspectives really help to inform the surface area of what Tomorrow Health has become over the years.
Yeah, absolutely. One of our former guests calls it the love triangle. You have the doctors, you have the payers, and the providers, and you have to find a way for all of them to to live happily ever after, which is easier said than done.
There's rarely a lot of love in that triangle, yes. Right? So you gotta make that happen.
Yeah.
And to your earlier point, I bet Wayne probably sees a lot of these pain points all the time when speaking to DME providers who are, still working in analog, right, Wayne? Very old school methodologies to handling things when, there's a better way of managing their business.
Yeah, the tribal knowledge is definitely something that is in every DME, and a lot of times, we're trying to get them to think about, if you're scaling, it's not scalable if there's tribal knowledge in one person's head of how to get paid with this product from this payer. How do you actually effectively train someone or multiply what you're doing? So it's definitely conversations that we have a lot of, how to start digitizing this.
Totally. And I'll just say, back to understanding it from different stakeholders' vantage point, I think, from day one at Tomorrow Health, the deeper we got in, the more we started working with suppliers of all types, small single location stores in a rural area all the way up to regionals and large nationals diversified in their product suite and ecosystem. I think that the biggest thing that has just grown is our empathy as an organization for how challenging it is to be an buyer. And this is an industry where really it's been so many entrepreneurs that have started small businesses over the last few decades to deliver, really critical and life-saving equipment and supplies to patients. And obviously it's been a challenging ecosystem to operate in, multiple rounds of competitive bidding, multiple rounds of consolidation, reimbursement challenges, inventory considerations, tariffs, right? I mean, it's really been challenging. And so, we understand how for an organization, especially smaller ones that have to manage so many different pieces together, they may not be on their own thinking about, okay, what are the best technology systems that I can put in place in my operations? Or, how can we do this in a scalable way that helps us get ahead and refocus our team efforts on the highest value things that are either going to grow the business or are going to serve patients in a better way. And, that's where I think both of our organizations, Tomorrow Health and Nico, try to step into.
Vijay, at a high level, how should DMEs and providers kind of think about Tomorrow Health? Like a network, platform, partner, or something new?
Yeah, absolutely. Well, I'll start in the kind of in order of how an order happens, right? So addressing it from each of those stakeholders. So I'd say to providers, we're just a much easier way for them to order DME on behalf of their members and to have visibility into the DME that their members are receiving. As we know, over the last decade, nearly all of providers ordered in an analog way, right? And thanks to the growth and development of e-prescriber over the last 10 years, you've got 20% or so of orders coming through through e-prescriber in a digital fashion, but the vast majority of that is still over fax or over the phone. And so what we did at Tomorrow Health is we developing a suite of products to streamline that ordering experience for providers. And it started with our own e-prescribe product called Gateway, that enabled ordering providers to select the products that they wanted, to answer the relevant insurance questions that were needed. And we believe that, like a lot of other e-prescribe products, has helped to drive that digital adoption in the ecosystem, taking something that took 90 minutes down to maybe 10 or 15 minutes. But what we found is that was still too slow for a lot of providers. And it was still slower than just sticking a printed stack of papers on the fax machine and pushing send. And what we set out to do across our engineering, data, and product teams was create an elevated experience that really enabled that ordering process to be even faster than fax. And that's what we've rolled out with our Horizon AI ordering solutions. And so for our Horizon product, a provider can really just drag and drop a patient file, and then we leverage custom built and prompt engineered LLMs to fully parse that, recommend the products, answer the necessary insurance questions, and enable them to process that order in under 60 seconds on average about 45 seconds. And we've seen just absolutely dramatic adoption from referring providers from this. We have 99% retention among providers that start using the ordering platform to expanding. We've seen the vast majority of the providers that were using our e-prescribe platform shift into AI ordering because it's just so much easier and so much faster. And we think that there are so many that AI has the opportunity to just transform this ecosystem by eating a lot of these inefficient manual workflows. And that's a great example of where we think value can be driven for providers. So for ordering providers, really accelerating and streamlining the way that they order DME and the visibility they have into it. For suppliers, critically, we are a platform that enables them to get clean digital orders, to grow their businesses from both existing and from new referral sources. And then thirdly, to work with payers in a way that is easier, strategic, right? We talked about it. One of the biggest challenges in this ecosystem is the upstream complexity of the payment rules, right? And if you sit there and you talk to a payer, payers are worried about, a million different things. They're worried about pharmacy and drug spend and labs and hospital readmissions, and DME is just one small component of that. So they don't have the same level of depth or understanding of some of the challenges in this space. And so what we've tried to do is really build technology solutions that streamline the way in which suppliers work with health plans, enabling them to get greater visibility into how they can grow and take on more and more share of order volume within a health plan's network. And we do a lot of the work of ingesting a lot of those complex payer rules and reimbursement guidelines that are different for Medicare Advantage plans and managed Medicaid plans and state-based waivers and so on and so forth, such that the pressure doesn't have to go on the suppliers to retain that tribal knowledge, and they can just leverage our platform to do so on their behalf. And the results that many suppliers have seen, 95% of the orders that suppliers receive through us are clean and serviceable, ready to action right away without any additional documentation. Suppliers have, a number of suppliers that we've worked with have cut their operating expenses down by 25 to 30% by leveraging the Tomorrow Health platform for the majority of their order volume. And then we've had suppliers that by joining Tomorrow Health and getting access to new payers networks have 2 or 3x'd this. And so for suppliers, again, it's all about efficiency, margin expansion, and critically growth. And all of those we think are really important in an environment where, we expect, unfortunately, reimbursement is going to keep coming down due to another round of competitive bidding and more health plans looking to, narrow networks perhaps and cut costs, and just an increasingly challenging dynamic where there's, we expect there to be likely more consolidation in the market, and we want to empower suppliers of all stars and stripes to be able to operate as efficiently as they can to build and grow their businesses.
Super interesting. And I think you may have answered a little bit of this question, but many DMEs kind of worry about losing control when working with large networks. I know you mentioned a lot of the benefits there, might answer this, but how do you address some of those concerns? I think you gave some really good points already about, how to scale using Tomorrow Health, but there's any other insights, of providers that might be concerned with losing some control?
Yeah, absolutely. The first thing I'd say is, today, on a really large proportion of the providers and suppliers that we're working with, we don't take away any of that control as it relates to how the suppliers work with health plans. In the majority of the payer orders that we're processing, we're just the technology platform. We're just the conduit. So we're not actually playing a bigger role necessarily in that ecosystem. And the supplier retains the same relationship that they would have with a health plan. The supplier would bill in the same way, but with the better inputs that Tomorrow Health is giving them. And they can just operate their business as they want, but with hopefully greater order volume, and two, without having to all the wrangling, to get those orders. And the last thing I would say just to that point, as it relates to the suite of product solutions that we've rolled out, is as we have heard more from suppliers about their needs and their pain points, we've worked and broadened that product suite. And so I talked about the AI ordering, really an elevation from ePrescribe to digitize and streamline digital ordering through AI. But the other thing we kept hearing from suppliers is, regardless of how easy you make it, an ordering provider, I still get a bunch of orders through fax. And how do I manage that? And so we have rolled out, similarly, a fax automation product that leverages the same LLM architecture that powers our Horizon AI ordering, but starts first by leveraging computer vision to fully digitize and transcribe all of the patient information that's been, and then processing that for through our AI models to identify missing information, reach out to providers, collect that, and process that order forward as a digital order. And so what it enables for our supplier partners is truly omni-channel order management, where they can leverage one system to get digital orders in a clean fashion, to process fax orders, and to have necessary action be guided for their team. So they don't have to do, the cognitive overload of determining for every order that comes in, what do we need to do for this, and treat everyone like a different object, but to have one platform that's. And in doing so, our goal is to empower and to enable suppliers, and certainly not to disintermediate them in any capacity.
Makes total sense.
Vijay, where do you see providers struggling the most? Would it be like referrals, reimbursement, staffing, coordination? Where are you seeing that right now?
On the DME supplier side,
Yeah,
Alex?
exactly.
Yeah. To a certain degree, Alex, it's all of the above. I think we ask this question to our supplier partners really, every day, which is, what's the biggest pain point you have in your business that technology can help to solve? And for the longest time, that continued to be around just the morass of work it takes to get. And if you look at the complexity of the DME order management process, it all starts upstream, right, with the quality of the information that you're getting, how it applies to that complex nexus of, what insurance information is required, obtaining that complete information and processing on downstream, right? So I think, order management and intake remains, I would say, the kind of biggest overarching pain point. Specifically, next would be fax handling, so orders that come through fax and navigating and processing those. The next that folks point to is around prior authorizations. And then it's around, denial and audit management and scrutiny. All that flows into, the ability to ultimately get paid for the work that suppliers are doing. And this is the biggest overarching pain points. And then, of course, it's some of these bigger macro questions of, how do I position myself best for a competitive bid environment? And whether it's CMS as the payer that's effectively narrowing network, or it's some large payer that's out there saying, hey, I'm going to, do my own kind of auction process and narrow the network. How can I, as a big or a small supplier, position myself most effectively in that? And those are kind of complex strategic questions that I think, unfortunately in this environment, suppliers are having to face day in and day out. And again, that's where we look to empower folks with the right tools and tech to just enable their organizations to be the best to compete in an ever-changing and dynamic environment.
Yep. And kind of to that note, looking ahead, Vijay, what excites you the most about the next 3 to 5 years of kind of what you guys are doing and home-based care in general?
Yeah. I'd really, point to three things. The first is the continuing leveraging of AI to transform how this ecosystem operates. And, we just believe fundamentally that AI has the potential to transform healthcare, but really to have outsized impact in DME. Because in many ways, healthcare has been the biggest laggard as an industry in adopting cloud-based or SaaS solutions. And a lot of that is the complexities of interoperability and the challenges of integrating with siloed EMRs and so on and so forth. But that's almost what makes it so ripe to leverage AI effectively. Because AI is taking complex workflows and kind of eating a lot of that otherwise, manual processing that still exists in this space. And so we've seen it manifest in our product suite threefold. One, with our Horizon AI ordering, 2, with our AI fax automation, and 3, with our suite of agentic AI solutions that we offer to suppliers. And we call that our THEA solutions, Tomorrow Health Expert Assistant. And these are really agents that we have built internally, leveraging millions of DME data interactions that automate a lot of the manual processes that our supplier partners have to do, whether that is navigating order management, whether that is communicating with a referral source or with a patient or a caregiver to give a status update or dynamic on an order. And the capability of these agents is truly unlimited. We've seen in our own business the ability to reduce our manual touch points over 70% over the last 7 months, leveraging the FIA suite of agents. And we've begun rolling this out to our supplier partners who are seeing really dramatic impacts in their own businesses. So it's all to just say, we believe that we're in the early innings of really what we expect to be an agentic AI revolution in this space. So that's number one. Number two is the opportunity to really transform the patient experience in DME. And, from day one, we had as our foremost value of the company to fight like hell for patients. It's always been our North Star. Many of our team members, like myself, have had personal experiences of just how they or their loved ones have borne the brunt of a lot of the administrative challenge bottlenecks we've talked about in this space. And for the longest time, that the best way to serve a patient in DME is to solve these upstream problems for suppliers, for providers, right? And I think as more of these get solved, we have the opportunity to extend that technology forward innovation to how we communicate and engage with patients. Everything from leveraging AI solutions around education on DME products or supplies, or 24/7 triage to help support the issues that we had in our own family when something would stop working in the middle of the night in a way that's obviously very difficult for suppliers, a customer service team, at all hours of the night. And the ability to provide greater choice, the ability to provide greater visibility, the ability to be proactive in the types of support that's provided. And in doing so, to not only create a much better DME experience for the patient, but enable them to be more adherent to therapies like CPAP-oriented therapies for sleep apnea or COPD, or to enable them to leverage better managed DME to stay out of the hospital and prevent a readmission or prevent an admission in the first place. So really leveraging technology to continue to improve the patient experience is the second. And then the third is expansion beyond DME into other areas of home-based care. And that's always been a part of our vision and focus. We focused on DME out of the gate because we found it to be one of the most critical and important, but also most fragmented and challenged parts of the home-based care ecosystem. But if you look beyond the products and supplies that are delivered, and you look to the services that are delivered in the home, you see similar types of administrative inefficiencies, similar types of fragmentation, and similarly, in some cases, challenged patient care and quality. And so leveraging the tools, the platform, the partnerships we've built to expand that technology-driven efficiency, coordination, and high-quality care into other areas of home-based care more broadly.
Great answer. Yeah. A lot to unpack there, but that was incredibly insightful for sure. I'm excited about all those things as well and kind of agree with all of those points. I'm sure, even I feel like both of our companies have been doing this kind of around the same time, and you can really tell like the fundamental shift like in the last 24 months versus maybe the prior 24 months before that. So it's, a lot of the stuff you're talking really deeply resonates with the stuff that we see every day and the stuff I interact with suppliers every day as well. So we're pumped for a lot of the same things and really excited about the future as well. I think the next 24 months will be even, things are only accelerating.
I did want to ask your opinion on something. Obviously, the healthcare system in general is, far from perfect. In your mind, if you could sort of like redesign a part of the healthcare system overnight, what would it be? One part.
How much time do you guys have? I feel like we need
only one part, not the whole thing.
Pour out a few here. Yeah. Fundamentally, I believe that healthcare in the U.S. is in the way that it's paid for. So I think the most important leverage point to change is how we pay for care, the type of care we incentivize, and the complexity of the insurance pools that govern how care is dispersed in the country. And so, more specifically, it's interesting. The biggest pain point that we talked about here in DME, the complexity of the payment rules, is actually on a micro level. DME is a massive industry, $75 billion, but relative to a $3 trillion healthcare system, right? It's one sleeve of it. But at a micro level, that's emblematic of the challenges from a payment system standpoint that exist all across healthcare, right? We've got Medicare, fee-for-service, Medicare Advantage, managed Medicaid, CHIP services, and commercial insurance, all of which govern a different sleeve of the US population that have a totally different set of coverage guidelines, reimbursement rates, in some cases, billing code, auspices. And all of this creates a lot of complexity around how services are priced. So you'll have a hospital system that is leveraging higher commercial rates to, offset money-losing government programs that they might be working with, for example. And as that payer mix shifts, which may totally just be dependent on the type of people that walk through the door, their business transforms dramatically, right? And yet they're providing the same service to each of those folks, but under a totally different reimbursement architecture. And so I believe that creates a lot of complexity in the system. It creates inefficiency. It has enabled the wide set of disintermediation that we have in healthcare, where we have employers managing healthcare for commercial insurers, and they're bringing on benefits consultants who are bringing on other benefit managers for different categories of care, and it just creates more intermediation and inefficiency between a patient and a care provider. And so what do you do about it, right? In my view, I think streamlining a number of those insurance business lines into, let's say, a much more consolidated exchange that enables for-profit to compete, to provide insurance care to a much wider, horizontally covered swath of the population, I think would not only create insurance pools that are much easier to manage from a risk standpoint than what we see today, but also eliminate a lot of the complexity and a lot of the disintermediation that has created some of these problems in the US healthcare system. So that's the biggest thing that I would change if I could wave a magic wand.
We'll have to have you back for part 2 and part 3.
Vijay for president. Yeah. Have you considered doing like TED Talks or something? You got some like very insightful points, and one of our probably best spoke podcast guests we've had so far. So this has been great, and really appreciate all this insight today.
I appreciate it, guys. Long time listener, long time fan, first time caller here. So I appreciate you guys having me on. And I'll just say, all the innovation you got to this ecosystem. I mean, you said it, Wayne. I mean, we've been doing this for some time, right? And I think both organizations have really worked to bring technology-driven change to the DME ecosystem. And I completely agree with what you said. The last 2 years have been, so exciting, and there's just been such more dramatic technology-driven acceleration. And I absolutely agree that the next 24 months are going to be a step change, even more exciting, right? And as these transformations have been happening, I appreciate the role that you guys have played in the ecosystem, and also, through forums like this, like bringing together innovators, operators, and supplier leaders to just share ideas on how to move the industry forward. So thanks for the work you guys are doing.
Yeah, absolutely. And the good news for you, we're actually not done. We got one more segment of rapid fire. So
Okay, great.
we got this. This is the easy part. Kind of like a this or that, but it's a fun segment, and then I'll let you get back to your busy day.
Sounds great.
Let's go. First word that comes to mind when you hear home-based care. Only one word.
Inefficient.
One metric that you obsess over the most.
supplier satisfaction.
If Tomorrow Health didn't exist, what problem would keep you up at night?
That's a good one. You know, probably the images, which I mentioned earlier. An equally tough one that I think is so important to enabling the right downstream care in DME and more broadly.
Awesome. Favorite productivity habit as a CEO?
You know, I think the biggest thing that I have learned over the years is to do more with less. And I think year over year, if you look at my calendar, there's actually more and more open blocks, even as the surface area and the scale of what we've been doing continues to grow. And I think I've just found that enabling both myself and our team to be deeply focused and to preserve the time and the headspace for us to dynamically engage on what are the most important problems for the business at any given time has ultimately, proven highest ROI.
Last one. Early morning meetings or late night Slack messages?
Is both an answer?
Both can be an answer.
Yeah. I think for me it's both. I think you ask my team that much prefer the morning meetings than the Slacks that they do get from me late at night, but better or worse, sometimes it's both.
Awesome, man. That's the last one I have for you. Really appreciate the time and the conversation.
Yeah, thanks so much for joining today. And if anyone who's listening wants to reach out to you or reach out to your company, what's the best way for them to do so?
Yeah, just shoot me an email, vijay@tomorrowhealth.com. Love to hear from folks, whatever role you're playing across the ecosystem. Love to have a conversation, love to have a dialogue, and so encourage folks to reach out.
That's great. Well, thanks so much. We really appreciate your time. This has been a fun one. Take care.
Thank you guys, appreciate it.